Hello, good afternoon, everyone from Geneva, Switzerland. My name is Alexandra Kuzmanovic, and it's my great pleasure to be here again with Mike and Maria, who are dedicating their time to answer your questions about COVID-19. Um, if you have your questions, as usual, if you're watching us on Twitter, please use hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, leave your questions via comment section. Good afternoon, Mike, Maria. I'm glad to see you finally again virtually. Next week, hopefully, it will be in person again. And while we're waiting our viewers to ask their questions, maybe you can share your views on the epidemiological situation at the moment, as we have, after several weeks in a row in decline, we are seeing again increase in cases around the world.
Yes, so hi, Alex. It's good to see you online, and we look forward to seeing you again in person. So, welcome back. Yes, I think, we're looking at the global situation quite closely. Um, we've been looking at a downward trend in incidence over the last 5, 6 weeks, which is really, really encouraging, and it's telling us that the measures that are in place, the individual level measures, these public health and social measures that we've talked about, the measures that are in place to actively find cases and carry out contact tracing, good clinical care, all of this is working to actually drive transmission down and suppress transmission. We have in the last week, however, seen an increase in cases again. And this has been noticed and identified and reported in a number of countries. And this is really quite concerning. And the reason that it's concerning is because the world right now is quite fatigued with this pandemic. And, with seeing 5, 6 weeks of really positive negative trends, positive declines in incidence, to see an uptick again, is quite worrisome. So there may be a number of factors that are responsible for this, but we're really looking into it. We don't have anything specific for each country, but what we are worried about, I could tell you what we're worried about is with the introduction of vaccines and vaccination in a number of countries, we still need people to carry out their individual level measures. We still need people to carry out physical distancing, working from home if they're asked to work from home, wearing of a mask, making sure you have good, clean hands, especially when you're putting on your mask, you're adjusting your mask, taking off your mask, making sure that you clean your mask regularly or you dispose of your mask properly if it's a single-use mask, that you have good ventilation in the spaces that you are in, you open your window, you avoid crowded spaces, you're following the local guidance. It's really important that everyone out there still adheres to these measures in place, because we have quite a ways to go to continue to drive transmission down. It's going to take some time for vaccines and vaccinations to reach all of us, to reach most of us. And while vaccines are being rolled out in many countries around the world, we need to still continue to stay the course and adhere to these measures. Because if we allow this virus to spread, it will. If we increase our social mixing, if we increase our exposure to the virus, it will take advantage of that and it will increase. And so that's what we're worried about by seeing this 1 week of increase in trends. It's a pretty stern warning to all of us that we need to stay the course and we need to keep adhering to these measures at hand. And I think that's one of the key messages we want to reiterate today to everyone out there. We know you're tired. We know you want this to be over. But we have a role to play. And we need to keep, doing every single thing that we can to protect ourselves and our loved ones.
Thank you, Maria. Mike, what are your views on this increase and change in declining trend?
Yeah, no more than, when cases are increasing, we say to everyone, it's are decreasing. It's never everything we do, and when they're increasing, it's never all our fault. So we just need to be, I think, at this point, be very calm and recognize the things that Maria has said. The virus is continuing to adapt. We may be relaxing a little before we've got the full impact of vaccination. And I know everyone is just so tired of this and so exhausted and fatigued, and the sacrifices that people have made in their social and economic lives, kids not being in school, that there's a tremendous desire to get back to something that looks like more normal existence for us all. The problem is every time we've done that before, the virus has exploited that. And the number of cases has risen rapidly, then the hospitalizations rise, and then the deaths rise. In this case, as we roll out vaccines, we hope we can avoid the worst impacts in terms of hospitalizations and death, but we're not there yet. 265 million doses of vaccine have been administered, but remember, 80% of those doses have been administered in just 10 countries so far. Just 10 countries. We have 9 different vaccines on 3 different platforms. We've had a huge success in the science and the ramp-up of the production of vaccines. And campaigns have started in 115 different economies, so that's good. But many countries are well behind in terms of their ability to get vaccines into country and to get vaccines out to people. So we're still playing catch-up on vaccines. So now is not the time to relax on our individual behaviours. It is not the time to relax on community measures. And if we are to do that too early, we risk that 4th surge or 3rd surge or wherever you are in your country, whatever the next wave will be, we risk driving that next wave of cases. And we just do not want to be premature. And we need to follow through on what we've all committed to do individually, as communities, as governments. And we need to accelerate as quickly as we can to get doses out. Great news this week was COVAX started delivering vaccines under the COVAX initiative. I think now 10 countries have received the vaccines. It's nearly 10 million doses have been delivered. That's a huge step forward in terms of at least beginning the journey towards better vaccine equity around the world. So we should celebrate too, even if we are suffering a bit of a plateau on a rise in cases. And that rise in cases is pretty much consistent. It's nearly affecting every WHO region. I think we've seen Eastern Med 5 out of the 6, 4 out of the 6. Yeah. So this isn't just an isolated phenomenon. This is happening pretty much all over the world. So we need to also think about, if we do get this disease down to lower numbers, and we've seen those numbers drop in countries, what are we going to do then? We're vaccinating our most vulnerable. We're vaccinating our frontline workers, I hope, and we can get equity in that process. That will give governments more policy options around how to open up society. Because if the consequence of opening is not immediate hospitalizations and death and tragedy, then governments have more options. But we shouldn't be working to dates. There is no date. The virus doesn't understand dates. What we understand is the number of cases and the number of new cases every day. We should be looking to get that number as low as possible. We should be looking to get the number of hospitalizations as low as possible. So we do have to continue, and I think for a significant period of time, our own individual behaviours, be it washing hands, be it avoiding crowded spaces, wearing masks, making sure if you're indoors that you're in a well-ventilated space with as few people as possible. These are things we are going to have to continue. This is not going to stop anytime soon. I think what we would all like to get rid of is the imposed measures where governments have had very little choice but to impose stay-at-home orders and lockdowns and closed schools. The things that have really, I mean, is wearing a mask or maintaining some physical distance or washing your hands or avoiding very crowded spaces, is that really what's driving us all nuts? Or is it the fact that our kids can't go to school and that we find it hard, we can't use public transport, or we can't travel more than X number of kilometres from our homes? The measures that, in a sense, governments have had to impose to suppress virus transmission. I think that's what we need to think about. How do we get rid of those big societal measures that are shutting down society? And the only way we get there is to get the number of cases as low as possible. And that's going to require continued individual behaviour. It's going to require, when the numbers get low enough, strong public health surveillance, contact tracing. I'm saying this for 14 months now. I feel like a broken record. And then linking that to vaccine. If we put those 3 things together, if we put continued individual behaviour to protect ourselves and others, if we put that with strong public health surveillance and contact tracing and those other measures we've spoken about, and we add into that vaccination, if those three parts of the equation work, then those big shutdowns and lockdowns can become a thing of the past. If we fail in either of those three things, if we fail in our individual measures, if we fail in public health systems being able to pick up again with contact tracing and quarantine and isolation, or if we fail in delivering vaccines in an equitable fashion to all countries in the world, if we fail in either of those three, I don't see any other options that we will end up drifting back towards large-scale societal measures, because the surges will come and governments will have no option. So to some extent, this is in our own hands. And I really understand how just exhausted and fed up everyone is. But right now, we're getting close. We see light at the end of the tunnel. Vaccination is beginning to roll out. So let's stay the course. And I know how easy that is to say and how hard that is for each and every one of us, including myself, to deliver on.
Thank you, Mike. Maria, you wanted to share as well some concrete trends on decreases and increases in cases around the world, right?
Yeah. So, I mean, when we think about this, I mean, I know we've been seeing these positive signs of reduced transmission, but it's not over. And then the last week, as I'm talking to you, I'm looking at the latest SITREP that we published yesterday on this, where we give weekly trends by region. And in the last week globally, we've had more than 2.6 million cases reported to WHO. That's a lot of cases being reported still. It's certainly a decline from the peak that we were at, where we had more than 5 million cases reported per week. But that's still a lot of people that are getting infected. So this is still a significant threat around the world. And that's a 7% increase from last week. And so we really do need to watch what we're doing. It varies by region, and of course within region there's a lot of differences by country, and of course even within country, the virus spreads unevenly. In the Americas, in our WHO region of the Americas, in PAHO, we've had a 6% increase in the last week. In our European region, we've had a 9% increase in the last week. In our Southeast Asian region, we've had a 9% increase. In the Eastern Mediterranean region, we've had a 14% increase. In our African region, we've had a 24% decrease. And in the Western Pacific, we've had a 2% decrease. So it varies by region, and it varies by country. If we look at deaths, reported deaths in the last 7 days, that is still declining. And I think it's the third week where we've seen a decline in the number of reported deaths. Now, this is really a good sign, that we are starting to see a decline. But in the last week, we've had more than 63,000 people die from COVID-19 that we know of. So this is a significant burden on all of us, and everyone who is out there who is lost, who's had somebody that's been infected, who has had a friend or a family member who's lost someone. These individuals cannot be replaced, and we mourn with you the loss of your loved ones. And this is far from over. We have tired health workers who are doing their best to provide care. As we are able to reduce case numbers, we reduce burden in hospitalizations, which give health workers a chance, to catch their breath in terms of caring for patients and have a little bit of recovery time on their own. But many hospitals are still dealing with large numbers of patients. So we are trying to balance our messaging with being hopeful, with the fact that public health and social measures work, including against the virus variants that are circulating. We are hopeful with vaccines and vaccinations rolling out, but make no mistake, this virus is still circulating, and it has a lot of energy to spread, as Mike has said several times. And if we allow it, it will spread, and it will continue to put people in hospital, and it will continue to kill people. So, it's a rally call. Let's continue to drive transmission down. Let's get it down as low as possible while we roll out these vaccines.
Thank you, Maria. There are a few follow-up questions, in particular to your answer, Mike. You mentioned that 115 economies have started the vaccination against COVID-19, and our LinkedIn viewer is asking, are we working fast enough to immunize the whole world population?
I think the plain answer to that is no, but I think we're going as fast as we humanly can to do just that. The COVAX initiative is one major multilateral initiative with CEPI, with Gavi, with UNICEF and other organizations to really ensure that we get fair vaccine distribution around the world. And it was just fantastic to see that rollout begin. That's the end of a very long road, very complex negotiations and processes and agreements. So the teams that have worked on that for the different organizations and the national teams who worked on the national plans deserve huge credit today for what they have collectively achieved. But that does not solve the problem entirely. There still are issues of vaccine supply downstream. And there are all kinds of other issues around bilateral deals and countries, you know, engaged in too much nationalism around vaccine supply. I'm the first one to agree that all governments have a duty to protect their own most vulnerable frontline and other workers. That's the sovereign duty of government, and they need to continue to expand their vaccination campaigns within country. That's an important right that any government has. But we also need to look at how we come out of this together and how governments can begin to share more doses of vaccine as they reach that moment where they've covered their most vulnerable. Can we see a way, as we've seen commitments from the governments of France and others, to begin sharing more doses of vaccine so that we can catch up the other countries who are further behind more quickly. So we're going fast, but we also need to obviously be careful that countries have the capacity to deliver those vaccines safely, and they have the trained health workers, and that they have the cold chains in place. This isn't just about bringing vaccines to country and dumping them at the nearest international airport. There's a very important process of generating vaccine demand, making sure the cold chains are good, the workers are trained, as I said, and the whole system works. And we've seen, even in the most developed countries, it took time to get vaccination programs moving forward in an efficient manner. It doesn't happen by itself. It requires a huge amount of technical cooperation and support in some countries from organizations like UNICEF, like WHO, in humanitarian settings from organizations like MSF and others. And there are countries that are in extreme states of fragility, where governments are not stable, where governments don't necessarily have access to the full population. And many international partners, both UN and non-governmental, are working in those countries to help support governments to move these vaccines quickly to the populations that need them, and including national non-governmental organizations. This needs a whole of society approach. So, you know, it's always frustrating. You never move as fast as you want to move, and we would like to move faster, and we will use every ounce of our energy to continue to accelerate vaccine distribution. But as I said, vaccines are only part of the answer. They're a major, major, major development, and we should be celebrating the arrival of these vaccines. But they're part of the solution. As I said, our own individual behavior, our ability to reignite public health surveillance linked to vaccines gives us a way out of those really restrictive measures that we've all been under for months and months and months. So there is a path, but the pathway out will not be a single thing that we do. It will be the many things we have to do and keep up over the coming months.
Thank you, Mike. There were a few more follow-up questions, as you were saying, when we see that cases are going down, what are the next steps and how we can open up safely? So one of our viewers is asking, when do you think large sporting events will be safe? And I know you're a football fan and you would like to go for a match and enjoy as our viewers, but do you think that will be possible in any time soon?
I think we're already seeing that. There's a number of countries in the world that are hosting and having large sporting events. So take a look at them. What do they have in common? Those countries have very low rates of disease. They have very, very good surveillance, and they have high levels of compliance of individuals with the measures that are in place. If you add in vaccination to that, then there is the opportunity for major sporting events to occur. But remember, the countries that have done it successfully, even without vaccines, have had great surveillance. They've been on top of every single case that occurs. They've invested in their public health infrastructure, and they haven't had to rely so much on these lockdown measures. So in a sense, sporting events are a victim of the overall lockdown approach. When you need to separate everyone from everyone else in society, why do you have to do that? Because you don't know where the virus is. And therefore you have to separate people so the virus can't jump from one person to the other. That's the scientific basis of many of these lockdowns. But if our individual behaviors are preventing that happening in the first place, and we're using vaccine, and we're identifying cases and isolating cases and identifying contacts and quarantining contacts, we're doing that by other means, by surveillance, by vaccination, and personal behavior. As I said, if we get those three things right, if we get individual behavior, if we get public health surveillance, and if we get vaccination campaigns right, then the need to continue lockdowns becomes less and less. And as the need to do lockdowns and these much more comprehensive measures becomes less and less, then sporting events become possible. And again, we've seen lots of examples in countries that have that measure of control. If you control the virus, then society can open up. If you're not in control of the virus, then society can't open up. That's unfortunately the huge trade-off we face here. And there are great examples around the world of countries that have done just that.
Thank you, Mike. Thank you very much. Maria, maybe this is a question for you coming from Maimouna Tariq, watching us on Facebook. How many variants have been discovered until now?
That is a fantastic question. So it depends on what you define as a variant. And I'm not trying to be cheeky here, but I'm sure everyone is listening to the news and seeing that there are virus variants and mutations being detected and reported all over the world. I mean, I don't know how many right now have been reported in the media. WHO, though, has been working with partners to come up with definitions of what a variant is. A change in the virus. You know, this virus is naturally evolving. There are mutations that happen at a normal rate. And there are variants that are being reported because there's genomic sequencing. There's sequencing that's being done in a number of countries. And the more sequencing countries are doing, the more variants are being detected and reported. What we have a responsibility to do in working with partners is to help understand which ones are important and why. So there are a number of variants of interest, meaning that we don't know the potential public health impact they have yet. We don't know what potential impact they may have on any of our countermeasures, including the public health and social measures that we've mentioned, or any impact on diagnostics, therapeutics, or vaccines. We published working definitions, and I say working definitions because they will likely change over time as we learn more, on a variant of interest and a variant of concern. And we've issued these to our member states, to countries all over the world, so that they can have some boundaries of, like, you know, how do we define which one is important, and a reporting mechanism to us. And then with those definitions, we've recommended what countries need to do to understand them in terms of studies that are on the ground, like epidemiologic studies, looking at trends and incidence, case numbers over time, looking at severity, and then also a number of actions WHO needs to take with our partners to better study these. So we are tracking many variants of interest around the world. We are reporting on, in our situation reports, our sit reps every week, 3 variants of concern that we're tracking globally. One was identified in the United Kingdom. This is the B117. We have one that was identified in South Africa. This is the B1351. And we have one that we are tracking identified in Brazil and Japan. And this is currently circulating in Brazil. This is called the P1. And what we are tracking are a few things. We're tracking where the virus is circulating, in terms of which countries this virus is circulating in. We are tracking the research that is ongoing by the countries to evaluate transmissibility. Is it more transmissible or not, and why? Any potential changes in disease presentation and severity. And also we are coordinating research on understanding the virus's impact on neutralization, on the body's ability to develop antibodies. And then we are linking, coordinating research with many, many partners and manufacturers on the potential impact of available diagnostics, therapeutics, and vaccines. So the three variants of concern that we are tracking, the one that was identified in the UK, first identified in the UK, first identified in South Africa, and first identified in Brazil. These viruses have a series of mutations, and some of them are quite similar. They've arisen at the same time, but they're different virus variants. And some of the research is saying that they have increased transmissibility, which means they can, actually the mutation that has been identified in these variants, it allows the virus to bind to human cells more easily, and it can infect cells more easily. And so there's increased transmissibility. Having said that, we do know that the public health and social measures that are in place, the hand hygiene, the physical distancing, the wearing of masks, work against these virus variants. There is some indication that the B117 variant has some evidence of increased severity, and that has come from some preliminary studies from the United Kingdom. And so, of course, that is worrisome, because if you have more increased transmissibility, you'll have more hospitalizations, and if you have more hospitalizations, you can potentially have more deaths because the system is overwhelmed. But we do know with these three virus variants that the diagnostics still work, which means we can still detect cases that are infected with these variants. We know that therapeutics are working, although there are a lot of studies that are underway to look at if there's any potential impact, potentially on the monoclonal antibodies, for example. And we do know that the vaccines that are out there work against these virus variants. Now, there is some suggestion that some of the vaccines may have reduced efficacy, but they still do work. So we need to make it clear that everything that I'm saying is at the present time. And I want to couch this in that way because we are watching science unfold, and we are watching research unfold in real time. And these studies are ongoing. So we are constantly learning about what these variants are and what these variants mean in terms of public health and medical countermeasures. So there's a lot that we're tracking. WHO has also established a global risk monitoring framework over the course of the past many months to look at these mutations and detect them quickly, report them, and then have a coordinated mechanism by which we study them and identify the triggers for decision making. What will trigger us to say, the IPC measures don't work? So right now we know that with these virus variants, our public health and social measures work, our infection prevention and control measures that are in place work against preventing the spread, and that's really important. Should that change, should we have a different virus variant that is identified and reported, we will make adjustments to our guidance. So we need to keep track of this in real time, and we're so grateful for all of our partners around the world in various lab networks and flu lab networks and HIV lab networks that are sequencing, our regional networks in PAHO and AFRO with Africa CDC. Many countries have really increased their sequencing capacity, and this is good because this gives us eyes and ears. But it is a lot of work to make sure that we not only look, but we also are triggered for action when necessary. So it's a long answer, Alex, but I think this is really critical because these virus variants, pose some uncertainties for us going forward, and we want to just make sure that we have a system in place to activate any changes that are necessary and alert our member states and all of you should something change.
Thank you, Maria. Here's a follow-up question from Jaya Kumar, watching us on Facebook. Are we publishing data about these new variants somewhere on our website where our viewers can have a look?
We are publishing them in our weekly situation report, where each week we have a section on variants. We alternate each week. One week we have a shorter section which focuses on geographic spread of the variants of concern. And then the following week we have a longer section which updates on research, updates on the studies that are coming underway. And we actually have a very helpful table. I find it very, very helpful because it outlines everything that we know about the variants of concern, the names of the variants, the different mutations that are there, the results of studies on different vaccines. So you can actually look in there and say the Moderna or the Pfizer or the AstraZeneca, what do we know about this right now? Transmissibility. And then it gives other links to other full reports from Public Health England, for example, or from researchers in South Africa, or researchers in Brazil. And so there's a lot of good information that we're sharing. And we're looking at various ways in which we can get this information out. It is a little complicated, so we want to make sure that we are informing people of what we know. But again, everything is at the present time, because it's a moving space.
Thank you, Maria. And here is one more follow-up question on variants from our viewer on Twitter. Is there a relationship between active case level and new mutation creation?
Yes. The more virus you have, the more chances the virus has to adapt. The more people that are infected, the more times the different variants of the virus, variations of the virus, have an opportunity. So it's opportunistic. It's random in that it's not been driven by anything particularly that we are doing right now, but it's been driven more by the background level of cases. If you imagine, we're in a scramble to control the virus, but the viruses are in a scramble with each other for who gets to survive. And like in all evolutionary processes, and we know that with evolution, that small random changes in any organism can confer on that organism an advantage or a disadvantage. Sometimes, very often, a genetic change confers disadvantage, and those lineages die out. Just now and again, a random change in the genetic sequence confers an advantage, and that's how evolution happens. That's how we got here. That's why we're who we are. The process with us has taken millions and millions of years. Viruses are the fastest organisms on the planet to make that adaptation because they exist in their trillions and trillions, and they're infecting millions and millions of human beings. Therefore, they get to buy a whole lot of lottery tickets in terms of their ultimate objective. I won't anthropomorphize them. The virus has no objective. It's just reacting to the realities around it. So therefore, more strains and more variants will emerge. It's a natural process, as Maria has said. But it's all the more accelerated when we have so much virus and so many people infected. So if we can get the numbers of people infected down to a much lower level, then that force that is driving that selection process will decrease. But it won't disappear entirely. These viruses will continue to evolve and continue. And that's why, as Maria said, we need constant monitoring of the variants of interest, the ones that pop up, but then to be able to sift out from all of those variants that emerge, we need to be able to sift out the ones that are of concern. So if new variants emerge and they just happen to have a slight difference that doesn't confer any specific advantage to the virus, then they're as likely to die out as not remain. But the variants of concern in general tend to replace the other variants because they effectively are more successful in their process of passing from person to person. And once they're more successful in that, they will eventually replace the original wild-type viruses.
Thank you, Mike.
Can I supplement
Maria,
that?
please, yes, sorry.
I just want to supplement that WHO isn't working alone in this space. So we are working with countries all over the world, ministries of health all over the world, agencies, all of the CDCs around the world, the US CDC, the Africa CDC, European Centers for Disease Control and Prevention, like all of this, the CDCs. And everyone out there right now, we have a peaked interest in genomic sequencing at the moment. And we need to use this opportunity to catalyze improving genomic sequencing worldwide, because it will not only benefit SARS-CoV-2, it will benefit all the work that we do on tracking viruses and pathogens around the world. And we have an opportunity right now to focus on enhancing existing systems. It's not about reinventing the wheel. We have incredible systems that are in place through our GISRA system, which is our flu network, through HIV labs, TB labs, polio labs. I just got off a call, coming to this meeting where we are actually working with many partners around the world to say, okay, how are we doing? How are you doing on increasing your sequencing capacity in the area where you work, in the region where you work? And where are the gaps? So we are looking to map the sequencing capacities And if we cannot find that capacity in a country, how do we support that regionally? We do not want to reinvent the wheel, and I will say that again, because we want to support the systems that are in place, to reinforce those systems in place, and build something that is long-term. So we use SARS-CoV-2 and the variants of concern as a real catalyst to kind of drive this forward. We have a lot of partners and funders that have reached out to us who want to support this, and we are so grateful. And we are working to consolidate all of this interest and kind of drive this forward and coordinate that response. We also need to tap into other untapped resources in countries where we have private labs, academic labs, veterinary labs, where you have that capacity local. But it goes beyond the sequence itself. We need platforms that exist that can house these sequences. Platforms like GISAID and others around the world, so that they're shared and so that analysis can be done with them. Sequencing for sequencing's sake is not helpful. What we need is the sequences to be shared with supporting data like clinical data or epi data, so that we could do what we call phylogenetic analysis and genetic epidemiology to understand virus evolution and transmission and what this actually means going forward. But we have a real opportunity here to build that. And this is done through collaboration. I have to say, as Mike was saying, this has been really hard for all of us in 14 months, and we all have our, really down days and troubled days, but the global collaboration around this, the interest in countries wanting to work together to share expertise, to train, to build capacity, to share results, before they're published in peer-reviewed journals for action so that we can collectively drive transmission down is inspiring. And we are so grateful for everyone that continues to work with us, to really end this pandemic. So I just wanted to take a moment to thank everyone that's working with us on this, because WHO, we don't do anything alone. We've got amazing staff around the world, but we have amazing partners around the world. And WHO, our teams, Mike's teams, in our health emergency program and his health emergency program, we work with thousands of scientists around the world, thousands, every single day. And that, we probably don't thank enough. So we're grateful for that continued effort to work with us for a common collective goal. Thanks, Alex.
Thank you, Maria. Here is the next question coming from Ruth Ramirez, watching us on Facebook. From the onset of COVID, it was determined that the virus could live in the environment for a period of time on various surfaces. Because of new variants, do we know if they are able to sustain their infection rates higher on various surfaces?
That's an excellent question. I don't have a complete answer to that because some of these studies are underway. So anytime we have a new virus variant, as I mentioned, there's a number of studies that need to be conducted. One of which is looking at virus survival. There's a lot of experimental studies that have been done in the lab to look at different conditions, different humidities, different temperatures, even lights on, lights off, of how long at different surfaces, paper versus steel versus cardboard versus wood. And those are experimental studies. I have not seen any studies that suggest that virus persistence is different with these virus variants versus the common type SARS-CoV-2 viruses. Should that, we see anything different, we will certainly, make people aware of that. But I have not seen any indication that there's a difference in the way these virus variants transmit in terms of the modes of transmission. And we haven't seen any indication, and we've specifically asked in countries where these variants are dominant, where they're circulating widely, are any of the interventions that are in place not working? Do you see any alteration, any increase in cases where you wouldn't expect where your interventions are in place? And we have not seen any changes in the modes of transmission. We have not seen any change in the way it spreads. And that's important because with any change, everyone wonders, what does this actually mean? Well, what it means so far from what we have seen is that our interventions work. Our infection prevention and control measures in health facilities as well as outside of health facilities work. The wearing of masks work. The hand hygiene works. The avoiding crowds work. Opening the windows work. All of this is really important, and so I think it's important to reiterate that.
Thank you, Maria. Here is the question from Stephen Michael Chidiaber. I apologize if I didn't pronounce that well. When you have COVID, how will you know that you have it? So, Mike, maybe you can remind our viewers of different symptoms they can recognize, and they should maybe go for tests and see a health professional.
Yeah, I think it's quite tough actually, because the basic symptoms of COVID are essentially like a bad cold or a bad flu in some cases. So generally people can feel generally unwell, malaise, they just don't feel right, and can get fever or chills that go with that not feeling well. They may or may not develop respiratory symptoms. They may develop a runny nose, they may develop a cough, they may not. They may lose the sense of smell, and that's been a common feature in the disease, but not specific to COVID-19. There are different phases. So generally the first phase of the disease is that fever phase where you just feel terrible. You may or may not have respiratory symptoms, and very often associated with fever. For the most part, people, and especially younger people without underlying vulnerabilities, will tend to get through that phase of the disease and recover. But a small proportion of them continue to have, even though they clear the virus, they continue to have longer term symptoms, and we've seen increasing evidence of long COVID, even in people with mild or moderate disease. For a proportion of people, particularly those people with underlying vulnerabilities, and particularly for older people who experience COVID, after that virus is cleared, very often people, and in some cases people can even feel a little better. They get rid of the fever and they think, oh, okay, the fever is gone. And then there's a second phase of the disease. It's usually after about day 8 to 10, after the onset of their symptoms, where they can develop this more serious disease, which is really mediated by inflammation in their system, either in their cardiovascular system and particularly in their respiratory system, in their lungs, where there's a kind of an overreaction from the immune system. Your own immune response is fighting the virus, and it sort of overshoots the runway, and you end up with this inflammatory disease in terms of your lungs become more inflamed, and in fact prevents oxygen passing between the air sacs and the blood. And that's the stage where very often people use corticosteroids and drugs like dexamethasone to try and reduce the inflammation. So there are kind of two phases to the disease, and it's not always the case. Nothing is absolute, but that's how it happens. So if you, and right now, given the level of prevention that's gone underway for all respiratory diseases, the incidence of influenza is very, very low. So if you're experiencing mild to moderate symptoms, particularly fever and respiratory disease, I mean, kids and others get the sniffles all the time, but it's not usual for adults to feel, the impact of respiratory disease. Then, you are a suspect case for COVID-19, and you should be tested. And that's, I think, the most important thing, is that you take action, get tested, isolate yourself from others, make sure your contacts are identified. And you don't need contact tracers always to identify contacts. If I get sick and I have COVID, I should be telling everyone that I've been in touch with that I have COVID, so that they can then take the necessary action to protect themselves and others around them. But testing is a very important part of this, because we're not always sure. And as I say, there are other conditions out there and other causes of respiratory disease, and particularly with people with underlying conditions. People can have other pneumonias that are perfectly treatable with antibiotics, for example. So it's very important that especially people with underlying conditions are properly examined by a physician, by a nurse, so that they can be properly assessed and put into the right clinical pathway. But it is tough at the beginning to be able to distinguish between COVID-19 and other respiratory diseases. Best to be safe than sorry, best to get tested if you can, and to look out for yourself and others in that process.
Thank you very much, Mike. Maria, do you have anything to add to this question?
Well, I'm just thinking on a practical standpoint. I have a husband and 2 kids, and I have a little one who's 2 years old who's in creche. and little kids get sick a lot. And you just think of, they come home and there's a lot of germs that circulate around. And I'm particularly thinking about this because in many countries right now, schools are starting to open again. And this is absolutely wonderful. In countries where transmission is being brought under control, kids are going back to school, and there are many safe ways that kids can go back to school and making that environment as safe as possible. And that's really wonderful. So that's good. But when kids mix, there's a lot of germs, not necessarily COVID-19, but there are other respiratory pathogens that circulate around. And I think in my own family, I think, what do? We take a precautionary approach in this situation. I asked viewers a few months ago to make a plan. So if you need a test, what do you do? In the area where you live, how would you get a test? Who do you need to report to? How do you make that appointment? And for us, what we do, my husband and I, if one of us is feeling unwell, first thing we do is actually alert our staff wellness here and just say, I'm just feeling, not feeling so great today. Here's my signs and symptoms, my age, my underlying conditions, if any. We just kind of give and say, we'd like to get a test. And that is supported from here. We make an appointment, we go get the test. And it's better to be safe than sorry. Because in most situations, there are other things that are circulating depending on where you live. It may not be COVID, it may be COVID, but you need to know. And in many countries, there are systems set up that you could book an appointment and get a test. Some have drive-through centers that you can do this. And in some countries, there's home tests that you could use, as long as those are approved by the right agencies to approve that they are well-functioning tests. And it's good to know. If you are feeling unwell in general, you should stay home. If you can stay home and contact your medical provider. Because if you are unwell, you need to report what that is to someone. In areas where you have fever and dengue is circulating or malaria is circulating, we want to make sure that you're also contacting a health provider if you can to ensure that you get the right type of care. And then get a test. Stay home if you can. Stay home from work. Isolate until you get your test results. And make sure that you list your contacts and inform your contacts. But it's all about the practical actions that each one of us can take. And right now, if you're watching, if you don't know how to get a test, find out. If you don't know what the steps are where you live, find out what that is. What are your options? Because we're 14 months into a pandemic. Testing has increased substantially around the world. There still are some gaps in terms of the abilities to get tests, but find out what it means for you so that you know what the next steps are and make a plan. And if you, like my husband and I, we don't have grandparents that live down the street and, we need a plan for our kids as well. Just think through those types of things, especially when you have a calm moment. I'm not sure anyone has calm moments anymore, but think through what you might need to do, and that'll help. Write it down so that you know exactly what you can and cannot do should you need a test.
Yeah, I think, Alex, we were talking about vaccination. If we're expanding vaccination and we need to accelerate, we also need to expand testing and the availability of testing and rapid testing at the same time. All of these things will help us to isolate this virus where it should be, away from humans, and do that. I've come out of a meeting today on therapeutics, on drugs. We're still doing a huge amount of drug discovery and running with partners and many around the world doing huge amounts of work on developing new therapeutics. And we know the value that those, when you arrive in hospital, test doesn't make you better. Even a vaccine doesn't make you better. What saves your life when you get to hospital is oxygen, it is early, good clinical care from a team who know how to manage you as a patient, and the availability of the right therapeutics. And we're not there yet in therapeutics. We've made huge advances in vaccines. We've made some advances on drugs, but not enough. So when we're talking about the ACT accelerator or accelerating access, we still have a huge amount to do in developing drugs for the future, for now and for the future, but also in rolling out testing. The testing is now available. The testing is getting cheaper. It's getting to the point even where self-administration of tests is available. So I think we're going to have to bring all of these tools online, not just vaccination. We've said it, I think I've been saying it too, since the beginning. There are very few silver bullets. There's no single solution in an epidemic. There's no one thing. There are no unicorns here. There is just a combination of different things that we do. And if we do each and every one of those things a little better, then we win. And Maria's going to kill me for sports analogies, but it doesn't.
On my own sports analogy.
Well, it doesn't matter what you do. It can be in an orchestra, for a philharmonic orchestra. The difference in timing and the difference in skill of all of those different musicians can sound like cacophony. It can sound awful if the performance of one individual or the performance of the totality or the timing of everybody is off. And there's a special moment when everybody aligns and everybody does what they need to do and they time that in a perfect way, and then that's where we get beautiful, beautiful music. Everything in life at this level, we are performing well now. We're getting vaccines out there. People are really doing a great job individually and complying with the measures. Doctors and nurses have got very good at treating cases. We've now become highly performant. We're performing well in the face of this virus. But if we want to get to the next stage, which is opening up, we're going to have to use every single area we need to look at. My behaviour, my community's behaviour, the effectiveness of the health system, how quickly we're rolling out vaccines, how well we're doing testing. If we improve 2 or 3 or 4% in each of those areas, then we win. What we can't do is say, oh, all we have to do is vaccinate people and this is over. That's not the case. There's much more to do as well. So the testing thing really struck me, because we haven't been speaking enough about that over the last few weeks, because everyone's become very focused on vaccines, which is appropriate. But we need to also continue to focus on testing and on therapeutics.
Thank you, Mike. Maybe before we start closing, we can also share some updates on the strategic preparedness and response plan that we launched last week, and what are the areas of work that this plan is covering. And I know that some parts of it are accelerator, including work on therapeutics, tests, vaccines, but it's much broader than that. So maybe you can share with our
Good. I feel like I'm on a cookery program now, because Maria referred earlier to the weekly epidemiologic update. There it is. It's my Bible. Yeah. I've got my copy this afternoon at about 4 o'clock, and I've already marked it up. So it's a really, really good way for any of you out there who fancy yourselves as amateur scientists to read this and see where the world is going every week. It's a great one-stop shop. It's on the web. It's there, available to you all. There's also a weekly operational update which shows what WHO and partners are doing around the world. Some really good examples there, case studies of the difference we're all making in the lives of people downstream. And lastly, this is the Strategic Preparedness and Response Plan for 2021. And I only show it to you because there's 4 very special people on the front, 4 health workers in the front line. And we definitely got our gender balance wrong, because they're all women. And I just remind you that 80% of the health services of the world, the frontline health services, are delivered by women. This is one area where women of the world have been for years delivering the bulk of frontline healthcare around the world, and they continue to do so during COVID. So we celebrate them and their achievements. I would just hope that in the higher levels of health services in future we can reflect that more systematically in terms of health leadership, because again, I think where we've seen more women involved in health governance, we've seen better performance in this response in general. So, but the SBRP is a continuation of last year. It really focuses us as an organisation on our efforts to support our member states and countries. And really it's aimed at stimulating the countries into renewing their annual plan for this year. And we will continue to put the vast majority of our resources into activities at regional and country level. Last year, 90%, 9 out of every $10 that WHO received was implemented through regional and country platform work. The other 10% was used here for global surveillance, for research and innovation, and for many of the other activities at a global level. We've been working with our donor partners over the last week or so to show them that plan. There's also another important document coming out, which is last year's summary. It's a summary of the response to COVID COVID-19 thus far, and it really has a lot of examples in it, country examples. Also on the web, and I don't know if you can post these afterwards, Alex, there's a massive compendium of country case studies, which is a huge number of case studies, which shows exactly how countries themselves have been responding to COVID-19. And there's some wonderful examples in there of community activity, of activity in the health system. And I think we should be collectively a little bit more proud of how we've all responded to this. It's been a huge lift for everyone in the system, from school teachers to nurses to police to grocery workers to seafarers, to everyone's had to adapt and adjust everything they do to stay safe and keep others safe. So while we need to face into another year of COVID, and there are no certainties, the variants introduce uncertainty, other things, we have the hope now of vaccines. We know better what stops this virus. We know better how to treat and save patients' lives. So my view, we look forward to getting as much support as we can for the strategic plan, but also the greater collaboration within the ACT Accelerator. There'll be a plan for that in the coming weeks as well. And we also have the humanitarian response plans at country level. Remember, we had Filippo Grande on last week, and each country, especially those fragile countries, will be issuing humanitarian response plans. We've just had the one for Yemen over the coming weeks. And it's really important, again, that everyone looks to support those countries that have the most conflict and the most fragility, because that's where people are suffering most from COVID and from other diseases. So thank you for the opportunity to show the world that we do have a plan, and that we rely, anything, Maria said it earlier, WHO is a collection. We're not anything other than our member states. Everyone talks about WHO as if it's something separate. WHO is the secretariat of 194 member states around the world. We represent their investment in global solutions, and our job is to serve all people in the world through those ministries of health around the world. And we recognize that it is through them and through science and academia and universities and NGOs and other UN organizations, and mainly, let me say mainly through these frontline health workers, that we deliver anything of value. And we celebrate them, and we work those hours and those weekends and those relentless days in order to ensure that they have the tools necessary to stop this virus.
Thank you, Mike. Maria, do you have anything to say as well about the plan for this year?
Yes, I do, because I'm very proud of this plan, because this 2021 plan is an extension of the last year's plan. And the first strategic preparedness and response plan that was published on February 4th, 2020. This was 4 days after the Director General, Dr. Tedros, declared a public health emergency of international concern, raising the highest level of alarm under international law and setting the world a plan to get ready so that we could take steps, to prevent as many infections as we can. And the strategic prepared, and I have my copy too, I have to show you because I mark it up. And I also have the one on WHO's response to COVID-19, because this is also a source of pride, because you see Mike and I, and the DG said it the other day, you see Dr. Tedros, Mike, and I regularly, but we have thousands of staff around the world who are working with ministries that are carrying out this work. It's a good read, so please read it. But in the Strategic Preparedness and Response Plan for 2021, our goal, and it says in here, it's to end the acute phase of the COVID-19 pandemic, to build resilience and readiness for the future. So we are taking this horrible situation that we are in now to make a better future on preparedness for the next infectious threat, because there will be one. And we have several strategic objectives that are in here. One is to suppress transmission. 2 is to reduce exposure to this virus by enabling communities to actually take the action that they need to reduce their exposure to this virus. To counter misinformation and disinformation, which has been a massive challenge this past year and continues to be a challenge as we go forward. to protect the vulnerable in all populations all over the world. And as part of COVAX, as part of the work of COVAX, is to ensure that we have vaccines and vaccination for those most at risk in all countries, as opposed to vaccinating everyone in a handful of countries. There have been tremendous steps being taken towards this, and I have to say I was so proud yesterday, and so I got a little teary when I saw a lot of those planes land in so many different countries of delivering vaccines that were developed, over the course of 14 months. It's astounding the speed at which safe and effective vaccines have been developed. The fifth objective, reduce morbidity and mortality from all causes. So we have to ensure that we have our essential medical services back online so that we are not only preventing deaths, severe disease and deaths from COVID-19, but we're also protecting against other diseases that are circulating around the world. And lastly, to accelerate equitable access to these new tools. It's not just the new vaccines that are coming online, it's the diagnostics that are being developed, the rapid tests that are being developed, and the strategic use of testing linked to public health action. This is what breaks chains of transmission. Testing for testing's sake, the same thing with sequencing for sequencing's sake, is not the best use of those resources. It has to be linked to public health action. But we need to make sure that we have access to these diagnostics everywhere, to therapeutics everywhere, as well as the vaccines. And within our plan, we have 10 pillars of work. We have added one additional pillar to what we had last year, and that's vaccination. So this plan is firmly rooted in public health response, in building that workforce to carry out all of these actions, coordinating this, risk communication, community engagement, and infodemic management, surveillance, epidemiologic investigation, contact tracing, and the adjustment of public measures and social measures as needed. Making sure we focus on points of entry, international travel and transport, and mass gatherings. That we have good laboratory and diagnostics everywhere, that we have strong infection prevention and control and protection of our health workforce, trained, protected, rested workforce, that we have strong case management, clinical operations and therapeutics, maintaining essential medical services and systems, operational supports for logistics and supply chains, and lastly, vaccination. So this vaccination is another incredibly powerful tool. It doesn't replace everything else that's there. We have to continue to do that, but we're adding something into this plan. Thank you for indulging me for saying this, but I think it's important that the world does know that there is a plan. We are constantly encouraged by countries that have taken this plan and adapted it to their system, adapted it to the workforce that they have and the capacities that they've had, and making it agile as the cases go up and the cases go down. So there is no one solution fits all. There's no one size fits all, but it outlines everything that needs to be done. And with good, strong leadership with enabled populations, COVID can be controlled, and COVID is being controlled in a number of countries. So we need to stay the course and really keep doing everything that we can.
Thank you very much, Maria. Before we close, I would like to just ask you on your thoughts regarding the discrimination we've seen during this pandemic, as Monday was Zero Discrimination Day, and we've seen some cases of discrimination in the pandemic against particular ethnicities or people who had COVID. So I thought we should acknowledge those who were victims of discrimination before we close in this. You couldn't hear me?
I think we lost you, Alex.
Maybe the world heard her, but we didn't.
Oh. I am trying to reconnect my sound with you. Do you hear me now?
Yes, we can hear you now.
Oh, perfect. Thank you. Sorry about that. So before we close, I thank you very much for presenting the plan for 2021 with our viewers, so they are aware of a lot of work we are doing with countries to stop the virus. Monday was Zero Discrimination Day, and I thought to share our thoughts on discrimination between during this pandemic against particular ethnicities of people who had COVID, so that we can acknowledge the difficulties they've been facing, and what are your thoughts on how we can stop discrimination and how it is harmful actually while we are fighting a deadly disease and the virus to experience such situations.
I think COVID 19 and the pandemic has exacerbated discrimination and stigma in many different ways. In itself, COVID-19, or the risk of having it, has been very similar to what happened previously with TB, with HIV, to other things in the past. Leprosy, I mean, the idea that someone could be isolated and marginalized from society because of a diagnosis of a certain disease. We're used to that. We've seen that with other diseases. And that's been very unfortunate. But I think in the main, people have understood that when you recover from COVID-19, you're no longer infectious. So we haven't seen that grow. But we have seen health workers being very stigmatized because of the risk that some communities perceive that a health worker returning from work could bring disease into a community. And that has been very, very unfortunate. But other than that, though, I think we've seen discrimination on racial basis, on perceptions around. I've seen terrible instances of discrimination against people of Asian descent, and that's not just from one country, but anyone with any Asian, not even being from Asia, but being second, third, and fourth generation people in third countries suffering discrimination based on misinformation and based on horrific prejudice regarding whole peoples around this disease. And that's been generated, and that's been driven, and that's been manipulated. That's not just happened by itself. And that's what's most disgraceful about it. Most disgraceful about it. That's the discrimination that emerges around the disease happens. We're all afraid of contagion, and we tend to be very careful around anyone we think may have a particular infection, particularly if we don't understand that infection. And that's a natural phenomenon that has to be managed through communication and education. The discrimination around race and the discrimination around profiling of certain groups because of perceptions, that's been driven, that's been manipulated, and that's been created. And that's utterly disgraceful. There are other forms of discrimination and marginalization that have occurred which really just exacerbate existing marginalization, be it for migrants or be it against refugees, or be it for people who just don't have access to services, who are marginalized within their own societies. And what COVID has done is really it's peeled back some of the covers we've had over the existing prejudices in our society, the existing stigmas and the existing problems of discrimination. And we've seen the impacts of long-term discrimination and long-term lack of access to good diet, lack of access to good healthcare, lack of access to good education has led to an explosion of underlying conditions that have in themselves driven the death rate. Remember, the virus is not the only thing driving death. What's driven death in this response has been having our older and wiser people in long-term care facilities in which the measures were not in place to prevent the transmission of infection. It's been whole sections of our society living with long-term health conditions created by the lives they've had to lead in terms of their education and social status and their access to preventive and therapeutic healthcare. And we've seen the unpeeling of that in our society. And we're paying a very heavy price now for that level of discrimination. We've seen also, we've had to be very careful and very clear on how we want to see prisoners and other people who are incarcerated treated, and detainees and others. So every element of this pandemic has uncovered and identified areas in which discrimination has increased. On the other hand, we've seen the most wonderful examples of solidarity, of opening up, of common understanding at community level, and recognizing that we are all in this together. The one thing the virus knows, regardless of our race or our color or our creed, is that we're human beings. And it's exploited our very humanness, the thing that joins us together. So on the one hand, I'm really, really upset, particularly about the profiling of groups, which has been politically motivated. But I'm also heartened by what I believe is still in the heart of all of our, most humans, is a desire to connect, a desire to understand, a desire to support each other. It is the negative forces in society that force us apart and force us to recognize difference and exploit difference and be prejudiced against difference. We maybe need to learn about how we educate and socialize our kids and create the situations we create, because we create these systems of discrimination that the virus has itself exploited.
Thank you, Mike. I just learned that on Monday was also World Compliments Day. So I'll use the chance to thank you for your amazing work and dedication, effort, leadership, bringing science and communicating about science clearly to the world, so that people can protect themselves better from the virus. And I use the chance as well to congratulate you, Mike, on another award that you received yesterday, Sir Charles Alexander Cameron Award for Population Health, based on your leadership in this response. We are so proud of you in WHO, and we are so grateful for the chance to work with you, for both you and Maria. I personally, and I'm sure that our colleagues feel the same.
I'm very happy to accept awards as long as on behalf of all of us who work in this space. Everyone should take a bow now and again, but awards are awards. They look good on the mantelpiece. They don't change anything. But what they do, I hope, is recognise just how important frontline health workers have been in this response, and communities and others. So we'll not worry so much about the awards, but maybe think about what they mean for us all in terms of continuing to give us encouragement to do better, even better every day, if we can.
Thank you. Thank you both. Until next week, I hope everyone will follow your advice and use all the tools to stay safe from this virus. Thank you very much.